We know Canadian hospitals are in desperate need of protective equipment. We just learned this morning 88% of doctors say their number one stress and concern is lack of access to the equipment. So, a new campaign called the Frontline Fund is where hospitals have come together to raise their own funds to fill in some of the gaps that are left by COVID-19. We're joined this morning by Carolyn Riseboro. She's the president and CEO at Trillium Health Partners Foundation. She is part of this committee. Good to have you with us on your morning.
Thanks so much for having me.
Caroline, part of the reason that this group of more than 140 hospitals and institutions have come together is to fill in some of the gaps that were left in funding for COVID-19. What are some of those gaps?
Well, oftentimes we think that government covers all of the costs of the COVID response, and they don't. And so what we're trying to do is raise funds, particularly for the frontline healthcare workers who are just facing unprecedented issues right now. So these are things like personal protective equipment, even helping them with things like meals because they don't have time to get out and get healthy meals. And then as well, we know that a number of them live with immune compromised family members. So how do we provide things like hotel rooms for them as well?
Yeah, these are the needs that we don't often think of. The goal of this fund is $50 million. That's how big the need is. You're at about $8.5 million so far. How has that money been used?
Well, we're actually distributing it to 150 hospitals across the country from coast to coast. And as you can imagine, different hospitals have different needs to be able to protect their frontline staff. And so while there's some flexibility to the funds, we are asking all hospitals to use the funds to support their frontline healthcare workers in the COVID response. So it can be everything from personal protective equipment to even some hospitals are looking at developing a vaccine where we would be protecting our frontline healthcare workers as soon as possible, and then the rest of the population as well.
Caroline, 10% of these funds are going to go specifically to the territories, to our northern frontline healthcare workers. How are their needs different than the rest of the provinces?
Well, we know sometimes up north, and particularly in areas where our Indigenous communities live, there aren't, let's say, what we would call big hospitals. So as a result, we're trying to be more flexible with the funds to allow them to support local community health organizations, or really to allow Indigenous peoples to tell us how to best use the funds for the COVID response in their area. So really having that flexibility to address local needs.
Caroline, if people want to donate, they can go to frontlinefund.ca. Is there anything else that you want to share with Canadians about the needs facing those in our hospitals?
I think at the end of the day, this COVID response is so dependent on our frontline healthcare workers. And we know that this isn't going to be a sprint. This is going to be a marathon. We need them to stay healthy. We need them to stay motivated. And they have needs as well. So I just encourage Canadians to do everything they can to generously donate to the Frontline Fund, support our frontline healthcare workers. Nothing is more important right now. And they can do so, as you mentioned, by going to frontlinefund.ca.
Caroline Riseboro, good to talk to you on your morning. Thanks for coming on.
Thank you so much, Anne-Marie.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.